All right, well, hello everybody. Welcome to our webinar titled Public Health and Dementia Caregiving, a new curriculum module for students and professionals. Thank you so much for joining us and being here today. My name is Eva Jackson, and I'm an Associate Director with the Healthy Brain Initiative at the ALZHEIME'S Association. And we are very excited to share the launch of this new public health curriculum module with you today. Much of the work that we do on our team is for public health departments, but this curriculum is designed for public health students, educators, and professionals. And we are thrilled to have so many of you from each of these diverse backgrounds here today. So really welcome to all of you. Before we get started, there are a few housekeeping items I'd like to mention. So first, we are recording today's presentation so that we can share it with those who are unable to attend today. Second, if you'd like to use the closed captioning, you can enable it using the toolbar at the bottom of your screen. And third, we are planning to have a pretty full hour today, so please feel free to put any questions that you have during today's presentation in the Q&A box, and our speakers or someone from our team will respond. We will hopefully have some time at the end to respond to questions as well. And if your question doesn't get answered, we will be sending out a question response document in the follow-up email after the webinar as well, and it will be answered there. So let's get started. Today, we will be talking about our new public health curriculum module, Public Health and Dementia Caregiving. So I will share some background on the Healthy Brain Initiative and the development of our broader public health curriculum. We will then also be joined by three excellent speakers who will share their unique perspective and work around dementia caregiving as a public health priority. So first, we will hear from Dr. Joseph Gogler, who is a professor at the University of Minnesota. And we actually partner very closely with him and his team on the development of this module through the Bold Public Health Center of Excellence on Dementia Caregiving, which he leads. Second, we will hear from Teresa Will, who is the Administrator and Executive Director at City County Health District in Barnes County, North Dakota, and was a roadmap strategist. And third, we will hear from Katie Brandt, who will share her experience as a dementia caregiver, as well as the work she leads with Massachusetts General Hospital and that she led as a part of NAPA. And then we will do a demo of the new Public Health and Dementia Caregiving module to share how you can use this curriculum in your setting. I'd also like to acknowledge the cooperative agreements with CDC that helped develop the work of this module and allow our speakers to be here today. Please note that the thoughts and opinions expressed today are solely those of the speakers themselves. So first, a little bit of background on the Healthy Brain Initiative, or the HBI as we call it. The HBI is part of the public health team at the ALZHEIME'S Association, and we work to support infrastructure for brain health, as we believe that everybody deserves a life with the healthiest brain possible. One of the ways we support this public health infrastructure is through the publication of the HBI Roadmap. And the HBI Roadmap is a public health strategy focused on reducing the risk and the impact of dementia for the greatest number of people possible. The updated roadmap was actually released this past summer, and if you're interested in learning more about it, reading it, or using any of the supporting resources, you can find them on our website at alz.org/HBI roadmap. And if you are somebody who is using this roadmap, the public health curriculum directly supports the outcome in the workforce domain to increase knowledge and skills of the current and the future workforce. So our intent with this curriculum is that it's something that can be used by you to support the work that you are doing with the roadmap. So the development of this public health curriculum came from the work that was actually done in previous HBI roadmaps and in partnership with the Rollins School of Public Health at Emory University. In 2015, the curriculum was developed under the guidance of an advisory board. In 2016, the curriculum was piloted with faculty from 15 undergraduate public health programs, and then it was released in the fall of 2016 as a 4-module course. Initially, the curriculum really was just intended for use in undergraduate public health courses. However, once it was released, there was interest and uptake by advanced degree programs, as well as interest from the current public health workforce. So from 2018 to 2020, the curriculum was updated and a video component was added, giving instructors the options to have students view the module content online, as well as have activities completed in a classroom setting. So if you're curious about these original modules, they are currently available on our website. I will note that they have not yet been updated to include new information about treatment and diagnosis. A few months ago, we celebrated the launch of a brand new online interactive module on health equity and dementia. And today I will be showing you the brand new public health and dementia caregiving module. And then in 2024, we will be updating those original curriculum modules on our website and moving them into this new online learning format. So by this time next year, you will have access to all new curriculum learning modules. So at this time, I'd like to go ahead and turn it over to our speakers to share how they have used or plan to use the the dementia caregiving curriculum in their work. So first we have Dr. Joe Gogler, who will be sharing why dementia caregiving is a public health priority and how he plans to use this module as an instructor. Dr. Gogler and his team at the University of Minnesota's Bold Center of Excellence on Dementia Caregiving were an integral partner in the development of this module. And in addition to being the director of the Center of Excellence, Dr. Gogler is the Robert L. Kane Endowed Chair in Long-Term Care and Aging and is the director of the Center of Healthy Aging and Innovation. So welcome, Dr. Gogler.
Thank you, Eva. Thank you, the Alzheimer's Association and the other excellent speakers here today. I first and foremost want to say how thrilled we are at the Bold Public Health Center of Excellence on Dementia Caregiving, myself, Elma Johnson, who is our center coordinator, as well as Maya Kofsky, our center specialist, to be part of this very, very exciting initiative. We have been so impressed by the existing modules in the public health curriculum that the association has developed that we just really jumped at the chance and opportunity to help contribute to this new caregiving curriculum. And my job today, in very brief fashion, will be to provide some overview and some ideas as to why is dementia caregiving a public health priority. And that certainly will then lead to the other excellent speakers today. And hopefully will get you excited about using this curriculum yourself amongst your community, within your institutions, academic or otherwise, et cetera. Next slide, please. So again, just wanted to acknowledge all of the great partners in this work, many of whom you've heard about already via Eva, Ms. Jackson. And again, this was certainly a team effort to create what, again, I think is just a real quality module that can be inserted within a very, very important curriculum. Next slide, please. So as mentioned, we're going to talk a little bit about dementia caregiving in the U.S., much of which is derived, and I'm happy to say many of the key take-home points from the annual Alzheimer's Disease Facts and Figures Caregiving section are also highlighted within this curriculum, but in ways that I think lends to very engaging educational content. I've had the privilege of authoring, or at least having authorship responsibility, for the caregiving section of the Alzheimer's Disease Facts and Figures report. Really, I want to say this might be my 11th year doing it. I don't know. I'm almost frightened to go back and look and see how many years it's been, but nonetheless, it was very exciting to take that information, which already is in a really excellent, highly palatable format in the Facts and Figures report, and then to put it into this curriculum. We're going to talk a little bit about why dementia caregiving is a public health concern, really briefly talk about what can public health do to address it. And then finally, as Eva had requested, I'll talk a little bit about how I would use this caregiving curriculum in my own work. Next slide, please. So when one grapples with dementia caregiving as a public health concern, I think it's really important to understand its scope in the US. And when I say scope, it's really thinking about unpaid care for people living with dementia as the core of long-term care in the US for those living with dementia. We know 83% of all the help provided to older people in the US comes from unpaid family members, and nearly half of all caregivers in the US are providing help to someone with dementia, specifically caregivers of adults. There are currently, depending on the estimates, certainly vary, there's more than 11 million dementia carers in the US. And I always like highlighting this statistic, which is if one had to put a dollar value on dementia caregiving. And even that is probably an underestimate, but let's say we removed all of the relatives, friends, other unpaid individuals who provide care for people living with dementia and say replace them with a home health aide, we would come up with a number of roughly $272 billion. And that's a big number, obviously, but what does that really mean? So if one contrasted that value with, say, the annual revenue of Walmart, it's roughly half. It is roughly 8 to 9 times the annual revenue of McDonald's. If you actually looked at the value of dementia care within states, in many instances, and I'll use Minnesota as an example where I'm from, that dollar value would actually put Minnesota dementia cares alone into the revenue of Fortune 500 companies. So it just gives you a sense of, when we think of long-term care, I think a knee-jerk thought is the nursing home, home health care, some type of formal support, but in the reality, it is the care provided by this vast network of unpaid individuals, mostly family members. Next slide, please. So why do caregivers of people living with dementia do what they do? And here are the most prominent reasons. Two-thirds, roughly two-thirds say they'd like to keep their loved one at home. And that clearly is important from a personal standpoint, a financial one, but then also from a policy standpoint, I would argue as well, in that what are we doing, what supports are out there, coordinated or otherwise, to help families achieve this objective. Another reason, roughly half of caregivers indicate that they provide care to someone living with dementia because they're the ones closest to them. And then 4 in 10 roughly say they do this because they feel like they should do it. There's a sense of love, duty, and perceived obligation. And these are the real reasons driving why people provide care to those living with dementia that do so. Next slide, please. So who are dementia caregivers? You see some key statistics here. I certainly will not go through all of these. I'll highlight some of the important ones. One thing we know is dementia care is certainly gender driven, in that 2/3 of all dementia caregivers are women. Also, 2/3 of caregivers actually live with the care recipient. Of those who provide care for over 40 hours a week, 73%, or nearly 3/4, are women. 1/4 are in what we call the sandwich generation, where they are simultaneously caring for, say, an older parent and then a child. 6 in 10 have been providing care for what we would argue is a long period of time. And there certainly are racial differences in how dementia care is provided. We know, for example, more Black caregivers provide over 40 hours of care per week when compared to their white counterparts. And roughly 7 in 10 Black caregivers are less likely to use respite services, even though they indicate a need for it. Next slide, please. And so what do dementia caregivers do? And when you heard me talk a little bit briefly before about sometimes the dollar values might be an underestimate for how much care is actually being provided by family members or other unpaid individuals to relative to those living with dementia, it's because when one looks at the literature, the research literature, one really can and should begin to appreciate the wide scope of help and assistance that dementia caregivers provide, well beyond helping with activities of daily living or instrumental activities of daily living, and actually moving towards having to assist and help with more complex medical tasks, such as managing medications, wound care, administering injections, those types of things, as well as almost being kind of the coordinator to help the person living with dementia navigate what is often a very fragmented system of support across many of our communities. Next slide, please. Here briefly, just showing some differences between dementia caregivers and non-dementia caregivers. The dark navy blue line are non-dementia caregivers. And you can see fairly consistently, dementia caregivers provide more extensive help with real basic activities of daily living, or those care needs that help individuals remain as independent as possible. Next slide, please. So how long do caregivers provide help? You saw a snippet of this earlier. Almost all caregivers have provided assistance for at least a year. And again, 6 in 10 are providing that help for 4 or more years. And this generally mirrors the trajectory of dementia. one thing that I find very interesting when considering these statistics is that people living with dementia are generally expected to live 4 to 6 years on average. That to me indicates that, in fact, formal dementia diagnosis still tends to be happening fairly late during the disease trajectory. And in fact, when one looks and asks family carers how long they've been providing help and assistance to a loved one because of memory issues or other symptoms we would associate with dementia, in many instances, families are saying they're providing help and assistance well before that predates a formal diagnosis or even formal recognition that there's a problem on the part of, say, a primary care provider, which I think for many of us in the field, that probably rings true. I know I've met many families, family members who've cared for loved ones with dementia. They'll say they've been caring for a loved one, a husband, partner, et cetera, 10, 15, 20 years. So this is definitely a long-term investment for many families and others. Next slide, please. Again, I think many of you are probably familiar with the overall effects of dementia caregiving. And again, I highlighted what I thought were some of the most striking effects, particularly health effects of caregiving. We know spousal dementia care, or those, those who are providing care to a spouse or partner, they are much more likely to indicate an increase in depressive symptoms when compared to non-dementia spousal caregivers. Dementia caregivers are much more likely to engage in these more complex care tasks. 40% of dementia caregivers, or a little bit over that, indicate that when they provide help, they're doing it themselves. They're not getting help or support from others. However, I also think it's really important to know when we talk about the public health implications of dementia care that close to half do say that caregiving is rewarding. Too often we tend to view dementia caregiving through this lens of stress, depression, burden, when in fact that doesn't necessarily reflect the lived experience of many families. And when we think about solutions, when we think about approaches for how to address dementia caregiving, best support dementia carers, we would be remiss if we also don't acknowledge that for many caregivers, they do it because they feel like they are supposed to, and they actually get they feel like it's rewarding and fulfilling, even though it's also simultaneously very challenging. Next slide, please. Thank you. And again, just kind of similar to what I already talked about in the prior slide. Next slide, please. One thing I think that's very interesting is looking at the prevalence of health conditions amongst dementia caregivers themselves. And here you see this is a table taken from Facts and Figures where for many conditions, chronic conditions, dementia caregivers are more likely to indicate having that particular disease or condition than their non-dementia caregiving counterparts or non-caregivers themselves. Next slide, please. And here is another, I think, important thing to think about when we think of the public health ramifications of caregiving and also the social impact is the degree of work disruption that often occurs for those caring for loved ones with dementia when compared to non-dementia caregivers. So you see here, close in 6 and 10 indicate that they either had to go in late, left early, or took time off because of dementia caregiving. You see almost 1 in 10 dementia caregivers indicate they had to give up work entirely because of caregiving, compared to half that many roughly of non-dementia caregivers, et cetera, et cetera. So certainly you see the ripple effects of dementia caregiving, not just on the individual, but then also potentially in their community, for their employers, society, et cetera, which again, really to me indicates the public health importance of dementia caregiving. Next slide, please. One thing I would point you to that I think is wonderful for those of you living in different states is the CDC, again, in partnership with the Alzheimer's Association, has a number of very helpful infographics based on what's called the BRFIS, the Behavioral Risk Factor Surveillance System data. If you haven't used these and would like to use them, I encourage you taking a look at them. I think these are very helpful to share with decision makers, perhaps policymakers, even community members to give a sense of what is going on in your state as it relates and pertains to caregiving. I often reference this one when talking to Minnesota audiences, and you may find that helpful when talking to audiences in your own states as well. Next slide, please. And then finally, what can we do about dementia caregiving? And this to me, again, really emphasizes the public health perspective in that the literature has evolved to the point where there are a number of, if not evidence-based, evidence-informed programs and approaches that can be deployed can be delivered by our aging service networks to benefit those caregivers living with dementia that could benefit from them the most. And I list some of the different types here. There certainly are other types out there. I think a key approach for public health is to connect those who might be on the front line of delivering these programs with guidance, support, tools, and resources to effectively implement and or adapt these programs so they can get them into the field in ways that are scalable, cost effective, and helpful. I would think this is a major gap that public health could fill as more and more public health programs and agencies, again, very much due to the support of the CDC, are starting to pivot towards. Next slide, please. Why is dementia caregiving a public health priority? And I list some of the reasons here. And this should be evident to you after going through my preceding slides. It affects the health of the population, both caregivers as well as care recipients too. Caregivers who are having challenges or stressed oftentimes then have to assist care recipients and may be influencing the health of care recipients in an adverse fashion. You've seen for women, for different racial and ethnic groups, the effects of dementia caregiving are unequally borne. And we've just talked about there are strategies out there that can be employed to reduce these effects. What can public health do? Next slide, please. And here are three main take-home points, I would argue, what public health can do. We go into these different strategies much more in depth in a couple of open access manuscripts that we published, and these will be shared with you in the chat, I'm hoping soon. But really briefly, what can public health do? Number one, public health can continue and hopefully in more and more granular fashion, identify who the caregivers are in our communities, what are their experiences and what is their health status, to really help communicate again to decision makers that dementia caregiving is having a real effect on our communities in ways in this way, that way, et cetera, to really help them hopefully motivate solutions, policy or otherwise. I think public health can continue to educate caregivers about the health risks of dementia caregiving and also to connect caregivers to effective programs. And I think this is really vis-a-vis building partnerships, engaging with our many vibrant partners in communities, whether formal or informal, to really help to bring to bear what we know can help dementia caregivers. And then finally, developing health-related awareness campaigns, et cetera, and education, particularly to really target stigma. I mean, stigma related to dementia is an issue that's brought up time and time again by people living with dementia and their caregivers. Public health could address that. Next slide, please. And then you see here are some real specific activities that public health can engage in, really kind of feeding off of my prior slide to address some of these gaps, some of these issues, some of these resource needs of families caring for individuals living with dementia. Next slide, please. Finally, I wanted to wrap up the public health aspect of my presentation by what are some other considerations to really help advance dementia caregiving as a public health priority, and what are some solutions? One is developing a national family caregiving strategy, which has occurred through initiatives such as the RAISE Council Act, really trying to move towards more family-centered care. Person-centered care, of course, is incredibly valuable. It is a paradigm in terms of how we care for people living with dementia. But oftentimes, and I've argued this, dementia is a disease of context. It influences not just the person living with dementia, but their families, their communities. It means we must achieve not just family-centered care, but I would also argue dementia-friendly systems care at the healthcare level, at the community level. We're starting to see breakthroughs in this regard. For example, vis-a-vis the Center for Medicare and Medicaid Services recent announcement of supporting the guide model, which will incorporate the person living with dementia as well as caregivers into a robust collaborative dementia care model. And here you see some other possible considerations too. Again, not just talking about and describing dementia caregiving as a problem, but what can public health do about it? Next slide, please. This came out of a really great publication, and Elma, if you have a chance, maybe share that, or I'll share the link myself to our attendees today. This was from Susan Reinhardt at the AARP. This came out the fall of 2022, and why I really liked it is the case that Susan Reinhardt made in her publication was, we know and we have identified key innovations that can be scaled. Program for all-inclusive care for the elderly, capable, integrating services within senior housing. The list goes on. How do we scale these, and what can we do to actually get them out there? And again, this to me is where public health can play a major leading role to get these innovations out to our communities. Next slide. This is a really great resource of identifying those evidence-based interventions for dementia caregivers. And most importantly, what best practice caregiving does is it offers a lot of guidance on how to adopt these programs, which is very much missing if one is just reading scientific articles or descriptions of the programs. What best practice caregiving does is it's a tool that can provide guidance on how to adopt these in your given setting, in your given community. So I wanted to really emphasize that as again, a solution amongst many in the space of public health. Next slide, please. Okay, I'm going to wrap up here by how I would use the public health and dementia caregiving curriculum. I think first and foremost is integrating these materials as a larger dementia-friendly or age-friendly public health course curriculum within academic programs. And in particular, I would think some of you might be familiar with ARP's Disrupt Aging Classroom. I provided some links here to you today, and these will be shared with you after the webinar. Is taking the public health and dementia caregiving, for example, aligning it with the Disrupt Aging Classroom initiative, which is really designed to talk about ageism and the importance of aging. And they have developed a really nice curriculum. That is certainly one possible example. I mean, and I think it goes without saying, these curriculums themselves, I think, are ready to insert into a number of public health curricula programs, whether it's at the master's level, bachelor's level, perhaps even the PhD level, to really, again, emphasize this point, which hasn't always been apparent in public health. Dementia and dementia caregiving is a public health priority. And the more we can emphasize that, the more I think it will elevate and hopefully generate resources and support in the end to help those caring for people living with dementia. The other area where I think this curriculum could be very helpful is within the geriatric workforce enhancement programs that HRSA supports. Again, there are a lot of, there's some excellent repositories of information that is maintained by the GWEP program. Perhaps these can be promoted there too, to get to professionals, to get to the care professionals as well as students in those health professions. And then finally, I'd be remiss in remembering, even though it's a curriculum, these materials I think could be really helpful if they're packaged effectively for communities themselves, vis-a-vis the outreach efforts we're doing, whether it's community conferences, presentations and such. Having these available and distributing them that way could be very effective too. And so I think I've gone through my slides fairly quickly. Again, engage with us. Lots of links being shared in the chat for you. I will be here to answer questions at the end. Thank you very much.
Thank you so much, Dr. Gogler, for the work that you're leading and your partnership on this module. I will mention a lot of the content that Dr. Gogler just covered is included in the module, as he helped write a lot of that content. So if you want to revisit it, share it, that is a lot of what is included in the module itself. So next, I'd like to welcome Teresa Will. Teresa will be talking about the work that she leads as the administrator and executive director at the City County Health District in Barnes County, North Dakota, to support dementia caregivers and its connection with this module. Teresa was recently awarded the Healthy Brain Initiative Roadmap Strategist funding, and as a part of that work, was able to support dementia caregivers through the local health department. So welcome, Teresa.
Hello, and thanks for the intro, and thanks to everyone for joining. I thought I would start with, first of all, saying how fortunate we were to be a part of the 2023 Healthy Brain Initiative cohort. We have learned so much over the past year. And then I'll share a bit about coming from a small public health unit, what some of the reasons are that we feel caregivers of health is so important, how it impacts public health, and why we plan to use, or how we plan to use, the curriculum moving forward. Next slide. So why do we care? The impact of caregiving on dementia caregivers is significant. And we saw in the slides that Dr. Gogler showed how significant it is. We have an aging population. North Dakota has a higher than average population of people over 65. One thing within the curriculum that I thought was very interesting, quote by Rosalind Carter: there are only 4 kinds of people in the world: those who have been caregivers, those who are currently caregivers, those who will be caregivers, and those who will need caregivers. So it impacts so many people. Within the public health workforce as well, as the overall workforce, the workforce is impacted. So with many employees providing care for parents and other relatives, you heard 70% of caregivers are younger than 65, so many are still in the workforce. Decreasing those negative impacts of dementia caregiving are going to lead to improved population health. Anyone who works in public health knows that we are looking at population health and how we can improve that. It's helpful for public health professionals to understand the perspectives and strengths of caregivers and how that impacts population health overall. Health equity has also been a strong force of public health, or trying to reach health equity. So paving the road to health equity, assuring that those with Alzheimer's and related dementias and their caregivers have the opportunity to be as healthy as possible. As I said, health equity is a core value of public health. Like most public health problems, there is little progress without using a multi-pronged approach. So working hard on community solutions. Next slide, please. Again, we are a small community, 10,600 in our county, and we're quite sparsely populated. With 23% of our population 65 and older. Next slide. Just a little bit about our team. We convened a team of various sectors across our community, and our primary focus was caregiver health. But in addition to that, we were able to work on encouraging early detection and diagnosis, education and awareness, and supports for caregivers. We developed a much stronger relationship with our local Alzheimer's Association representative. Next slide. Some of the things that we did throughout the year and continue to work on. We did a June Blitz where we did just a lot of information sharing on brain health. We spoke to a lot of groups. We had radio PSAs, did a lot of social media, had posters out and about. We were able to develop what is called a memory cafe, an event that is ongoing each month, where we can provide an opportunity for individuals with Alzheimer's and their caregivers to have some socialization, some support, and receive a little education. And we continue to work towards being a more dementia-friendly community in all aspects. Next slide. Some of the things that we did within our public health unit and locally, we provided education for all our public health staff and looked within each of our public health programs, determining how we could add Alzheimer's dementia focus or a lens, how to look at what we're providing and how we might be able to include information on Alzheimer's and dementia. So we looked at the immunizations, foot care, WIC, harm reduction visits. We do a lot of physical activity and nutrition, tobacco, correctional health. All of our programs were able to add something regarding education or awareness. Several of our Healthy Brain Initiative team members were trained as community educators and began providing educational opportunities within the community. We developed, again, that much closer relationship with Beth Olson, who is our program manager for the Alzheimer's Association, Minnesota, North Dakota. We've been able to do a lot more referrals. It's really streamlined streamlined the way things are done, the process for getting a referral. And just a lot of awareness and education. Next slide. And then finally, plans for us moving forward. I will be retiring the end of the year, but I'm quite certain that we have support within the city county health staff here at the health unit, as well as the administrator that will be starting the first of the year, to continue to move things forward. So the modules that are in the curriculum are a perfect way to encourage and allow or even require staff to gain a better understanding of dementia caregiving and self-care. We intend to use it when we're onboarding staff. There are so many resources within the curriculum that can just provide additional information and awareness. We plan and have shared the opportunity with local public health across North Dakota, with the local colleges, with long-term care. It's a great way to help students and staff gain a better understanding of dementia caregiving, but also a great way to get additional awareness of public health. With our access to so many community groups and policymakers, often convening community meetings, we have numerous touch points to provide education and awareness and to provide ongoing health advocacy. We'll continue to relate prevention strategies through other public health programming. Just that simple statement, heart health is also brain health, really resonates with people when you use that. And we will continue to assess our local needs through targeted community health needs assessment questions. Our community health assessment is due in 2024. So hoping to add some questions that are going to give us a better understanding of where we're at specifically in Barnes County. And then develop community strategies within the community, within our community health improvement plan. And as I said earlier, there's always additional work to do in trying to move towards a more age-friendly public health system with policy systems and environmental change. Thank you for allowing me to present and to be a part of the Healthy Brain Initiative. I think the curriculum is a great way to continue to educate and to provide information for staff and students, and we'll continue to use it as we can over the next years. That's all I have. Thank you.
Thank you so much. We just really appreciate hearing about the work that you're doing at the local health department. I think it's helpful to hear the big picture, the data, but then to hear about the work that's doing and hear about how this module might be able to supplement that work and support that work that you're doing. So thank you. Finally, so I would like to welcome Katie Brandt, and Katie is the Director of Caregiver Support Services and Public Relations at the Massachusetts General Hospital Frontotemporal Disorders Unit. And today she'll be talking about dementia caregiving from the national, community, and personal perspective. So I met Katie when she was co-chairing NAPA a few years ago, and she is also one of the speakers featured throughout the module itself. So when you go through the module, you'll get to hear her talking there as well. So welcome, Katie.
Thank you, Eva. It's such a joy to be a part of initiatives with the Alzheimer's Association, because I can just really see the impact on the national scale, but also in the one-on-one experience with families and for myself. Next slide. So today I want to talk about my role as the Director of Caregiver Support Services at Mass General Hospital, and how I can interact with the public health workforce, community partners, and students so many students, medical students, speech and language pathology students. And through my work out in the community, through my public relations role, I get to connect with students in health policy, public health, and work, as Eva mentioned, on policy initiatives, such as when I was co-chair of the NAPA Advisory Council with Dr. Alan Levy. But truly, I want to start by sharing my personal experience. Eva, if you advance one more time. That experience started with a vow, right? Here, my husband and I are standing on the steps of our alma mater, St. Anselm College, about 21 years ago, and we had big plans. We had plans to go to graduate school and step into careers that would make a difference. Plans to buy a home in a community where we could put down roots. Plans to have a baby and start a family. And we were very good planners. We achieved all of those goals by our 5th wedding anniversary. But what we didn't plan for was Mike's diagnosis of behavioral variant frontal temporal dementia at the age of 29. Next slide. Public health connects across generations. Here's a picture of my wonderful parents and my sweet baby, Noah, who is now 15, so much bigger than this picture. And I show this picture because this is another thing that we didn't plan on. I didn't plan that my mother would have a heart attack and die unexpectedly, and that my father, just 17 days after her passing, would be diagnosed with Alzheimer's disease at the age of 59. Next slide. So I found myself at 29 years old, in charge of, caregiver for, connected to 2 adult men with progressive neurological disorders that cause dementia and my infant son. I became that one of the 1 in 10 that Dr. Gogler mentioned, deciding to step away from my career. And I truly felt the financial impact of my role as a caregiver. I cite this paper, this study that was led by Dr. Jim Galvin, supported by the Association for Frontal Temporal Degeneration, published in 2017, that talks about special needs for atypical and young onset dementias, specifically that thinking about this total annual per patient cost of care for FTD is around $120,000 a year, nearly twice that of Alzheimer's disease. And why is that? Well, Alzheimer's disease has a typical age of onset of 72. That's a time of life where likely you've retired, you've paid off your mortgage, your kiddos have flown the nest. But the typical age of onset for FTD is a full 20 years earlier, the age of 52. That is when people are at the prime of life. They're at the prime of their careers. They have many financial responsibilities, especially if they're parents, when they may often still have minor children in the home or be supporting kids in college. Thinking about the level of support and care that younger caregivers need if they're working full-time, if they're that sandwich generation raising children. And so for me, the weight of caregiving caused me to step away from my career, lose our home to foreclosure, and spend every dime of our retirement savings before Noah graduated from preschool. Next slide. I wanted to make this slide as a busy, overwhelming representation of all the things that caregivers must juggle. Thinking about how I worked with Social Security, the Veterans Administration, Medicare, Medicaid, applying and managing supplementary nutrition assistance programs, SNAP benefits for food at the grocery store, working with elder law attorneys. This slide only represents my caregiving role for my dad. Dad is a veteran. I have been caring for him for 15 years. Today, he's living in a wonderful skilled nursing facility where he's receiving excellent care, and he's also on hospice. I point out that this slide only represents the care and the organizations, the entities that I had to interact with for Dad, because you'll notice that nowhere in this slide does it talk about annual wellness visits for me as a caregiver. It doesn't recognize the pediatrician appointments that I had to bring my son to, or the time that I spent with my husband when he was living in skilled nursing care. Caregivers are juggling an immense amount of care activities. Some of those care activities are helping your loved one in the bathroom. Some of them are making a meal that you know they'll eat, organizing an afternoon of activities that will lead to a calm and peaceful bedtime routine. But it's also this: many hours on the phone, on the computer, driving to offices to drop off or collect applications, and constantly feeling like when you've got a handle on one thing, another thing starts to slip away. I would fully endorse public health initiatives that make navigating systems easier for caregivers. Next slide. And so what happens? Caregivers for people living with dementia report high levels of stress and depression, which negatively affect their overall health and increase their risk for serious illness, hospitalization, and even mortality. I just even think that as a caregiver, when I became incredibly stressed, I knew that I couldn't fully be the parent that I wanted to be. I wasn't able to be a part of the workforce at all. And I wasn't taking care of myself. I've been honored to facilitate a caregiver support group for the last decade. And in our meeting last night, one of our seasoned caregivers said, I want everyone to remember here, you as a caregiver, you're human, you are important, and you need to be a caregiver to yourself so that you can be a caregiver to your loved one. This is where public health can step in and provide that support. Next slide. We need to remember that one diagnosis, you get one patient in a neurologist's office, two diagnoses, right? The diagnosis, when you diagnose someone with Alzheimer's disease, frontal temporal dementia, or a related condition, you're actually doling out two diagnoses because then someone else is the caregiver. And so we need, I like to call this the caregiver trifecta, which is a care planning approach that keeps the person with the diagnosis and the care partner, the family, at the center, but it connects people with the medical community, the disease community, and the home community, because we know that all care does not happen in the clinic. Next slide. So what does that look like? When we're thinking in a big way about how do we help families not only survive the experience of caregiving, but thrive, to feel that their values and their goals of care are realized, to know that they've done everything they could for their loved one and helped them to live the highest quality of life possible, despite dementia's looming presence. So connecting with the medical community means that you get that expert diagnosis. If you don't know that your loved one has Alzheimer's disease, how can you know to reach out to the Alzheimer's Association for care and support? Of course, in the home community where the living happens, living with dementia, we need respite programs so that caregivers have time for appointments for themselves, so that caregivers can do that paperwork without staying up until 1 a.m. Area agencies on aging can provide a wonderful connection for home care. And memory care, skilled nursing, palliative care, and hospice. These are opportunities to build your team. I talk with caregivers all the time, and I think for myself that an unexpected benefit of using community-based programs to help me care for my loved one was I got to be a family member again as my primary role. And patient advocacy organizations like the Alzheimer's Association can provide support groups, educational opportunities, and even patient registries so that when those new therapeutics are available, persons with a diagnosis and caregivers can participate. Next slide. And of course, Teresa mentioned this quote as well. And here are two of us, me as a caregiver and my husband as a person who needed care. Mike passed away on April 19th, 2012 at the age of 33. Just over 3 years after his diagnosis, 21 days after our son Noah turned 4, and only months before we might have celebrated a decade of marriage. Mike lost his ability to speak, walk, and swallow, but he never lost his voice. As Mike's wife, I was his biggest advocate, and I continue that advocacy on behalf of other families walking the journey today. Next slide. I've been honored to raise my voice through print media, a PSA on the Discovery Channel. I even got to interview Dr. Fauci to talk about why are COVID vaccines important for persons living with dementia and their caregivers. But really, what has been so important to me about this experience is that caregiving is often invisible work. It is unrecognized, it's hidden away. And so raising my voice has given me the opportunity to point out that caregivers need these supports. And there are so many ways we can do it. Next slide. I was thrilled to be nominated to the Napa Council and then overjoyed to be co-chair with Dr. Levy. What a privilege, and felt like really getting another degree in Alzheimer's and related dementia policy, but especially proud. Please look at this amazing paper that Eva led all of us on to publish about the 6th goal to accelerate action to promote healthy aging and reduce risk factors for Alzheimer's disease and related dementia. This is about public health, thinking about how are we reaching people in their home communities to help them thrive and live their highest quality of life. Next slide. So I know we're getting close to the end of time, Eva, I want to turn it back to you, but thinking about how educated advocates are empowered advocates. So every advocacy group related to Alzheimer's disease and related dementias, have your advocates take this public health curriculum. It's incredible. Education. Students have no idea what dementia caregivers are dealing with and how that impacts other systems in society. We can offer this to students on the ground level so that they can think in a bigger systems way and have that dementia lens. And the same for our elected officials. Implementation, thinking that this can create inclusive policy development. When we talk about health equity, of course, it's about race, ethnicity, socioeconomic status, gender, but it's also about being neurodiverse. It's about including people with disabilities and their care partners. Next slide. Public health promotes and protects the health of all people in their communities, right? All life is valuable. Living with dementia, you are a person with a valuable life, and you deserve to thrive, to reduce suffering, and to save money. That's incredibly important. So thank you all for your time. And Eva, I'll turn it back to you.
Thank you so much, Katie. Thank you so much for sharing your story with us today and sharing the work that you're doing. I think it's always helpful to be able to connect why this matters, who it impacts, and what we really can do about it. So I will say, I think we may run over a few minutes today. We will be sending out the recording and slides afterwards if you do have to drop off at the hour, but I do want to take this next time to go ahead and walk through what the curriculum is going to look like and how you can access it so that you can be integrating this into the work that you're doing in whatever setting that might be. So this is the landing page. When you get to the curriculum module, when you open it up, this is what it looks like. And I will note up front that this module does save a learner's progress, so they can come back to it whenever they like to finish it. And I'm just going to share a taste of some of the interactive components offered by the module, and then encourage you to go check it out for yourself. So throughout the module, learners are going to read through different topics, completing activities as they navigate each section. So we do start the module with the video of a dementia caregiver, and it's actually Katie, who we just heard from. And we do this throughout to just help center the whole module around the idea that we are talking about dementia caregiving from the public health perspective, but that the stories of individuals and people are so important to hear and keep in mind as we do our work. So we include several of these videos throughout to emphasize the different voices of lived experience intermingled with the data and the interventions. The first section on who are dementia caregivers starts with the public health imperative of supporting dementia caregivers. Some folks may have joined today wondering, why is dementia caregiving a public health priority? By now, I think we're all on board, but we want to start off the module by answering that question up front, and that it impacts so many of us, whether we are, have been, or know somebody who's caring for someone living with dementia. So again, just wanting to help learners learn right up front, this is why it's a public health priority. One of the activities you see throughout is to engaging learners are flip cards. So here is an introduction to health equity in dementia caregiving, in which learners would flip the card to learn about different groups that are disproportionately affected by dementia caregiving. Another activity throughout are knowledge checks. So these knowledge checks do ask learners questions about what they have learned, but their scores are not used to track completion or tied to their learner account. The intent is that these are just a moment for learners to pause and apply what they've been learning. And then each question does provide an explanation at the end and allows learners to retry if they want to. Under caregiver roles, one activity that helps learners understand the broad range of tasks that we heard about today that a dementia caregiver might be doing is this board game. So here we ask learners to navigate through different tasks a dementia caregiver may engage in to understand the breadth and the depth of support that they may be offering to a person living with dementia. Joe mentioned some of these, but as part of the section on supporting dementia caregivers, we discussed different types of evidence-based supports. And so if here a learner would click on different types of interventions to learn more. We also feature case studies throughout. So this one is of a person who's working in a local public health department who might be interested in supporting dementia caregivers. So this activity walks the learner through different steps in the process that the professional may take to really get this work going at their health department. And then finally, we showcase success stories of work being done by public health entities across the nation to support dementia caregivers. And these align with the 10 essential public health services. I will mention a lot of these come from a toolkit developed by the Bold Center of Excellence on Dementia Caregiving, which you can also research. But in this interaction, a learner would click on each service to learn more about a public health action that is being taken. And then the module concludes with next steps and additional resources and readings. So these are things a learner can do to continue to engage with and apply what was learned in the module. So that's just kind of the overall look and feel of the module, which I hope is just enough of a taste to make you want to dive in fully. To access it, you can go to our website, alz.org/public health curriculum. And if you're interested, you can go to the website now. I'm going to go ahead and walk through the process of sharing some of the resources and then actually accessing the module. So we do have several resources that support the module itself. The first I'd like to highlight is the instructor guide. And so this is designed as a supplementary resource for instructors to use to complement the material learned in the interactive module. So the instructor guide has discussion questions, it has application-based learning activities, it has sample test questions, case studies, video resources, graphic resources, and then other readings and resources that may be useful for you to adapt to your learning and teaching environment. We also have a one-page flyer. So the flyer is just a short, succinct way for you to share information about the module with other partners, organizations, instructors, or learners who might be interested in this and using it. The third resource I'd like to mention here is the link to our Living with Alzheimer's for Caregivers free online course that we have. So this new module is a great resource to learn about public health level impact of dementia caregiving, but we did want to include the link here for caregivers who are looking for information about being a caregiver themselves. So this is just one of several great resources the Alzheimer's Association has designed specifically for caregivers, and we thought it might be a good starting point for someone who's looking for that. And then finally, we also have the link to the module itself. So here you would just click on Start the Module, and it takes you to the Alzheimer's Association's learning management system. So you can get here using that link at the top of the page. I just personally prefer to go through the link on our website, as that has all of the other resources as well. At the top here, you will see our public health tab, and this is where our modules on health equity and dementia caregiving live, and it will also be the home for our other resources as we continue to build them out. So in order to access this and other free education from the Alzheimer's Association, you do have to log in with a free account. So when I get to this page, I always recommend logging in first, as it makes finding all of the other courses I have started or completed much easier. So if you click on login or register, brings you to this page. And if you've used the Alzheimer's Association's learning management system before for other trainings, you can enter your existing username and password on the left and click login. If this is the first time you've used the system, you click on create account on the right. And once you have an account, it is easy to access and keep track of all of the many resources available on the learning management system. So after you've either logged in or created an account, it brings you back to this page, and you can now click add to cart, view enrollment. So if you click on either add to cart or view enrollment, whichever shows up for you, it takes you to this page where you can launch the interactive module. So when you click launch, it takes you to the landing page that I showed you earlier, and then you go through the whole module. It takes about 90 minutes to go through the whole module, so we don't have time for that now, but I hope you take some time to go through it and see it and think about how you can use it in your setting. When a learner has completed the entire module, this short survey is unlocked. And so this survey is a user experience survey, and it does ask about what was learned and then how it will be applied moving forward. And as many of you know, being grant funded, we greatly appreciate the responses and feedback we receive through the completion of this survey. And then once that survey is completed, the completion certificate is unlocked. So if you click here to print the completion certificate, you get a PDF with the learner's name and completion date. And this is something that learners can print or share with instructors to demonstrate completion of the module, since it is only available once the entire module and survey are completed. To help you in your teaching environments, we have also developed the step-by-step guide for learners to follow, and it lives on our website as well. So this is something you can post or share to guide learners through all the steps we just took. Our goal really is that this is something you can take and begin using as soon as you want to. It is something learners can do individually, but comes equipped with the additional learning supports for classroom settings to supplement that online learning. So maybe it would be used as an extra credit activity or something that's used for a new hire that's working in aging or public health. So this is a free, ready-to-use resource designed to support our current and future aging health professionals, all on our website at alz.org/public health curriculum. And this module is just one of the many excellent products and opportunities that come from the Healthy Brain Initiative. So you can use this code here. You can also sign up on our website to get our e-news. This is where we announce the release of our other work, and we'll be announcing the release of our next modules in the spring. So thank you again for joining us. I do think we're a little over on time, so we will respond to questions in an email if we have not already been able to answer them. I do want to thank you again for joining us, and thank you to our speakers. We do have a short evaluation survey that we would ask you to complete, and we'll put it in the chat. You'll also see it when you leave the webinar, and it will be in our follow-up email. So thank you all again for joining us, and we look forward to seeing you for the next launch.